This is our lifestyle medicine update for April 2025, and we have a lot of variety of articles this time around. So we're going to go all over the body and all through lifestyle with these few articles. The first weekend is cervicogenic vertigo, where 20% of adults actually have this, and what people don't realize is when they get dizziness, they'll go to a neurologist or to an ENT. If everything is negative, which we really hope, then it turns out no one really knows what to do, so they're given endless amounts of pills and tablets to take with the intention of suppressing what? A perfectly normal reflex that's in the body. You see, the eye, the balance device, and the neck muscles, they're all connected to each other through this little triangle of reflexes, meaning as people start to age and the muscles become weak and they end up in deformed postures, or they spend their time staring at a screen that's at a fixed length away from their body, the pupillary muscles start to spasm, the head goes forward to relax these muscles, and those start to shorten artificially, and the end result is you get an adult who now has vertigo, or giddiness, or dizziness. And what do people do? Tablet, tablet, tablet. Pill 'em, and then bill 'em, right? But that's not the right way to approach these things. And if we do address muscular imbalances across the spinal column, these people can actually improve. Until we had all this technology like CTs and MRIs, a lot of healthcare was based on just a good physical exam and common sense. People get more and more imaging done. The imaging gives you some kind of something positive, and people treat accordingly. But it misses out the basic things. So before the age of CT MRI, we had a syndrome called Barré-Rue's syndrome, and many people that have this kind of vertigo actually have this. They will have trigger points in their neck that improves with prolotherapy, and then with a corrective postural exercise program, they can actually do quite well. Next is a completely different topic, where we look at abortion in women who have type 2 diabetes or gestational diabetes. And what this whole study looks at is just, is there an association or not? What they find is those who have these two conditions are often going to have a higher abortion rate than just a regular mother who doesn't have those. And where does the type 2 diabetes come from, the gestational diabetes? Part of it is the way a person has genetics and that sort of thing, things they can control. But a bigger part is the kind of food they're eating. Are they eating food, or are they eating food products? Because food products will often be high in carbohydrates, fats, salts, and sugars. Food, especially whole food, plant-based kind of diets, tend to have a greater variety of micronutrients and overall are better for the person. The next thing is along the same lines, but it's cardiorenal syndrome and life's big 9 factors. So some people talk about 6 pillars, some talk about 7, essential 8. This group has 9, and they look at the association between the 9 factors of well-being and then cardiorenal syndrome. And what they find is that, yeah, if you do the opposite of what's good for you, you're going to have all these problems. Common sense, right? But the other side is they find that diets that are very high in inflammation, those kind of things lead to these syndromes even faster. Along the lines of diabetes, we have type 1 diabetic children, and a report from what they did during the pandemic. So it turns out that these kids that had type 1 diabetes through the pandemic used telemedicine services a lot more, 93%. But they also are consuming a lot more food, and it doesn't really say what kind of food, but they were availing healthcare ease due to telemedicine. Along those lines of unhealth, we have obesity, and we have a group that's proposing using microneedles to deliver drugs to people with obesity. Is obesity deficiency of microneedles and drugs? No. There's often very solid lifestyle reasons that can be addressed like this. But this is the latest hype. Microneedles can sell for a lot. You can give drugs that way. Is it the right thing to do? You be the judge. Treat the symptom or treat the condition. Next, we look at diet as a treatment for children with obesity. And it's kind of common sense that if you decrease their total caloric intake and increase the nutrient value of their food, they're going to do better. Many of these obese kids, they're kind of stuffing themselves with just calories. Moving on, we're going to go into sleep after cancer. And what this report goes on to show us is people who survived a cancer, while they might be cancer-free, 95% have a delayed sleep onset, 85% have intermittent awakening in the night, 72% have a decreased sleep duration overall, and 67% have kind of a morning dysfunction, grogginess. This is not a surprise. Cancer is a pretty big thing to go through and to survive, and the body's kind of resetting. But it's important then for people to look at sleep after cancer so these things can be addressed. Because again, if a person isn't getting restorative sleep, they could relapse, they could have worse, they could have a shorter lifespan, or just poor quality of life until it's time. And the last is looking at inflammatory arthritis and depression. Kind of another no-brainer, common sense thing. And the longer a person has an inflammatory arthritis, the more they're going to go into depression. I guess it was even more true in the older days before we had all these disease-modifying treatments. But nonetheless, it's something to keep in mind because, again, being depressed means less physical activity, sedentary lifestyle, muscles become more stiff, more pain, more depression. And that can still happen even in this age with all these fancy drugs. The last study we're going to look at is health behaviors of children who've been discriminated against. And what they took is 4 different samples where people were raised in environments where they're treated as children who are well treated and no discrimination versus places where they are discriminated against. What they find is in the long run, these people who now become adults have less health protective behaviors in their life, meaning they don't take care of themselves as well as someone who did not get discriminated against. We can't change what we go through as children. What we can change is how we respond to it. And then we can also change how we take care of ourselves. Basic awareness of the factors that promote wellness is critical to anyone's well-being.